Hello, everyone. My name is Brady, and welcome to the CHEG654 crash course on Module 1. This is the first video of 4 in a series giving a brief overview of the vaccines course here at the University of Delaware. My hope for this series is to give some insight into what the course is all about and help college students here at UD learn about the course and determine if this is a course they would be interested in taking. Module 1 covers the historical aspects of immunology, covering a variety of viruses and the successful vaccines that have helped to largely eliminate these diseases today. The first disease we will cover is smallpox. Smallpox initially, the fighting of the virus started with variolation, which involved exposing people who had not previously been exposed to smallpox pustules as an attempt at immunization. So, smallpox pustules were the spots that would appear on people who were infected with smallpox. So, they would be administering kind of the pus from these pustules and be administering it to people who had not yet been exposed to smallpox. Um, the smallpox vaccine was first developed by Edward Jenner in 1796. He had observed that milkmaids had an immunity to smallpox, so he used the cowpox material from cows for the formulation of his vaccine. But there were some unethical experimental methods. He did administer the first successful vaccine to a 9-year-old James Phipps, but this would later lead to the eradication of smallpox with some changes to the vaccine. They eventually wiped out the smallpox vaccine by 1980 as determined by the World Health Organization. But this took a while due to a lot of funding and distribution issues, getting it to essentially every corner of the globe. Moving on to DTP, this is a combination of diphtheria, tetanus, and pertussis. Now, these diseases largely target infants and young children. The diphtheria toxoid was developed in 1923. Toxoid is a certain form of vaccine. Tetanus toxoid was developed in 1924, and then 2 years later, they finally developed a pertussis whole cell vaccine in 1926. However, these three vaccines would not be successfully combined until 1949, and they will require booster vaccines early in infancy and one later on in the teenage years to ensure that you are totally protected against these three viruses. Moving on to polio. Polio involves contaminated fluids entering the GI tract, and these viruses can make their way to the central nervous system and potentially can result in paralysis. So yearly, about 35,000 people were fully disabled by polio in the 1940s. You can see here there's a child in the iron lung that was an early form of treatment against polio, trying to keep these polio patients alive. So Jonas Salk formulated the first vaccine against polio. This was an inactivated vaccine involving injection. And this was licensed in 1955 and was hailed as essentially a savior. However, there were some issues with that. So Albert Sabin created a live attenuated vaccine that was administered orally called the OPV, and this was licensed in 1961. So after some production issues with the IPV from Salk, that resulted in some people being injected with live poliovirus, and people people getting the virus, the OPV was chosen as the better vaccine. So this largely contributed to a near global eradication of polio because it was very easy to distribute the OPV and administer it, just because it is an oral administration. So thanks to Sabin for helping that happen. But in the 1990s, they did discover that the IPV, when formulated or when manufactured correctly, is safer. So that the switch was made back to IPV late in the 90s. Moving on to yellow fever. This is a virus transmitted from mosquitoes to humans. It can result in liver and kidney failure, and the fatality rate is roughly 50%. So if you get yellow fever, the chances of you surviving are not great. This vaccine, with attenuated strain and immune human serum, was released in 1937. They would release a serumless alternative found in 1938. However, they wouldn't switch to this serumless alternative. Essentially, by human serum, it means human blood. So, this human serum full vaccine resulted in an infection of over 300,000 US soldiers in 1942 with hepatitis B. So this was kind of a big sign to manufacturers that the serum-less alternative is much safer, and they definitely should have checked the human serum beforehand to ensure that it was clear of any other viruses. Finally, the MMR vaccine was MMR was the last virus or disease that we would look at. And this is a combination of measles, mumps, and rubella. Measles, mumps, and rubella can all cause rash and fever and a lot of swelling. And rubella, being the most dangerous of the three, has a mortality rate of roughly 20%. Now, all three of these vaccines were released in the 1960s, and they would go on to be successfully combined in 1971, being administered to, again, mainly infants, as these diseases primarily target children. So a series of injections would fully protect these young children against these three diseases. Now, finally, many different research studies being done for all of these different viruses affecting humans resulted in a gradual increase in rules and regulations involving ethics surrounding these research studies. So they really have come a long way from Jenner's first tests when he performed on young children, or when he performed testing on young children. He really did not honestly receive consent at all. He didn't warn anyone, the parents or children, on the effects of what might happen. So this led to a lot of children subjects that he worked with contracting contracting smallpox. So the Nuremberg trials resulted in the Nuremberg Code being established in 1947, which provided a very important advancement of research ethics. This mandated 10 policies that must be adhered to when conducting research on patients, some of them including voluntary consent or a patient being able to withdraw from the study, or the requirement of the research that this study is performing. It must be important to helping the human condition. You can't just be performing tests on people without reason. And finally, informed consent was a term that would come around later on in the late 50s. Essentially, patients must be made aware of risks associated with being part of the study, and there must be alternatives provided to the patient if this study is something that might help a condition that they have. They must be provided with alternatives. Also, the patient's participation is 100% voluntary. They do not have to be part of the study if they do not want to. And all of this information, all of this informed consent must be fully documented to ensure that the that research or that informed consent has been gained by the researcher from the patient. And that is all for Module 1. I will see you in the next video regarding Module 2.